Okay, we're back and we're live. We had a slight pause there while some copies needed to be made. So again, your first one should be a $302,670 adjustment. Is that what all my colleagues are looking at for their first one?
Yes.
Okay. Now this one said reallocate funds from our jail medical to health environmental programs in order to provide sufficient funding for HUD lead abatement program. Why'd we have to do that?
I can take care of that part.
Okay.
Kamal Keparu, Finance Director for Health, Human and Veteran Services.
Yes, sir.
In a quick summary, the HUD lead abatement grant is a federal grant, and what we found over the last couple of years, they have some in-kind services, so we gotta fund it with, support it with general fund. So what we did was reduce the general fund that we had available in the jail medical area to move it over to the HUD lead area because we were short general fund. And typically in most of these federal grants, we do run a little short because of our chargeback and overhead, because federal grants won't cover our overhead charge. So we have to make up that difference by adding general fund.
Okay. What does the HUD guidelines call for in terms of the amount of dollars in their grant that are available for administrative?
I mean, you can, some of them 10%, some of them 15%. It all
But
depends.
we're talking about this one.
I have to look at the detail. I'm not sure or what the number is for this one,
So as
but I can get back with you.
yeah, as a county, we're exceeding the administrative amounts that the feds allow under this grant, so we have to supplement it with general fund?
Yes, let me clarify a little more.
All right?
I'm saying when we say administrative, I'm going to break it down in a couple categories. From our standpoint, you got county chargebacks,
Right.
right? And then you have our department overhead. So say, for example, well, you understand? Do I need to go
Yeah,
any
those
further?
are both administrative costs.
Correct. So say,
You got to pay MMB and you got to pay your light bill.
correct. Plus central, the whole, the county, and you got corporation council.
Right.
Payroll, yeah.
Right.
And
All
for
of
the
the
most
different
part,
departments that
correct.
touch this.
And typically when you, and I'm quite sure you are aware, because you've been here a while and been involved in the conversations about chargebacks, federal grants just don't cover it, just to be direct. Most of those funds have to go to services. So if we can't send it to the grant, how do we cover that charge?
Yeah. $300,000 is a lot of cash.
Right. Now, all of them may not be 300,000, but I mean, we hit 300,000, but we
No,
had
I'm
that.
talking
right.
about this specific
Correct.
one.
But I'm saying all of this 300,000 may not be the whole administrative cost.
Well, that was
Right.
my next follow-up question. I didn't know if it was in your bailiwick. Is all of that 300,000 going to, well, I'm calling it overhead, either chargebacks or the overhead of the department, or are there additional services that are being provided by this 300,000?
Well, on the sheet you all have, I don't know what page it is, but you see the breakdown. Most of the 300,000 is going to service and contractual. So that would be for the services. Let me see. I want to say it's your third page. Nope, your fourth page. Down towards the bottom to the right, you'll see
Service.
5,000 for personnel. Then you got
Right.
fringe cost, personnel, pension. Then you have the service and contractual.
So, yeah, we only get 2 pages, but we do get that page.
Oh, okay.
So services and contractual services, is there any way that chargebacks come into that?
Yes, chargebacks
Because-
are in there. But if I remember for the HUD layered grant, most of that is the services for folks going out, checking, I guess the homes. Right, that's the word, subcontractors.
Right, yes. Carol Osterberry, Health Officer, yeah, services and contracts would be for the lead abatement, the actual work, the windows, the paint.
Not the chargebacks to Corp Counsel, not the chargebacks to MMB or any other department?
Again, I can go in and if you're asking how much are the chargebacks or that administrative cost for this particular grant or business unit, I have to get that for you.
Okay. Because we have to report, no, we don't have to report this to the feds, right? Because this is our money.
What you mean? Well, this is a federal grant, so we're definitely reporting to the feds.
Report all these numbers,
Oh, most definitely.
including this 302,000, back to the feds.
Well, not necessarily. What we
That's what I was
report
getting
to
at.
the feds is the total amount that we're spending. And I'll say it this way. And yes, on the federal report we turn in, we would have to show the amount that we're supplementing.
And is
Which would
that,
be general fund.
Is that shown as a lump sum, or do we have to break it down into categories of what we're adding?
I have to check that particular report, so I can't answer
Because I'm
that
just
now.
wondering if that is already there.
What
The
you mean by that?
chargeback numbers or the overhead numbers or whatever you
Yes,
want to call
typically,
it.
I would have to just look at the report we submit to the federal government. Usually it's in the in-kind area, so I just have to see the actual report we send to the federal government, which is not difficult. I just have to put my hands on it, and I can follow back up with you.
Okay. Yeah, if you could just maybe send a copy of that to the committee clerk, what we report to the feds on this, because I would be curious. I mean, if we were spending 220,000 of this 302 on chargebacks, I would have a whole nother series of questions if that was the case. So I'd be curious as to how much of this winds up in direct services, because if we're also taking general fund money to increase, as you know, for the whole time you've been in the county, whether you've been in the commissioner, in the executive branch, we have had robust discussions about lead abatement programs and how much is being covered out there. Ever since I've been on this commission for the decade or so, we've had robust discussions about how much money we're putting towards lead abatement. And so it's good news if we are pulling a few $100,000 out of our general fund to increase the amount of work we can do out there of lead abatement and kind of supplement the HUD. To me, that's a great story to tell. But if we're pulling money out of general fund to cover chargebacks and that sort of thing, that's it has a different cast to it then?
Well, I can tell you that we're not doing that. I can tell you
Yeah,
that when we get a grant, most of those funds are going to their intended purpose. But
Well-
when we add the overhead charge, usually we just add the general fund to cover that difference. But we do not reduce the services.
I'm not suggesting that. I'm not suggesting that at all. But if we put every nickel of the HUD grant to these services, and then we pull general fund money to cover the overhead, but no additional services, that's a little bit different of a story than we're putting additional money there that actually increases the services above and beyond what the HUD grant is giving us. So I guess that's what I would be interested in. Out of this 302,000, how much of it is going to direct services that we can do more? I guess that's the real question I'm interested in. I don't know if my colleagues have any input on that, but to get a real picture of actually how much we're doing out there. Because we know it's not enough, as so many things in local government. It's just not enough. Because we're dependent on Washington and Lansing to have some stuff rolled downhill to us. And a lot of times their needs come before ours, and we just don't get enough funding in local government. So that I would be very much like to see how much of this 302,000 actually is increased services and we're doing more. If that means we can do another 20 houses or something, be interested in that.
Okay, I can provide that, but I also would say from a broader perspective, and Mr. Abbo may know this, but one thing, managing federal grants are difficult, because typically federal grants, they don't give you enough resources to manage it.
Yep.
And it's a whole lot of stipulations to manage it. So adding general fund just to support is one thing. And so I only mention that because we have to look at it as a department to decide if we should take, federal funds.
Right.
Because you can easily get into want to do a good service, but on the flip side, if you don't have the structure to handle the grant, you can end up on the back end getting findings and so forth and so on.
Right.
And make the organization look bad.
Yeah, and so that's why I want to pursue this a little bit, because this is what being in local government is. And just sitting in this chair for the years I have, I am aware exactly, Mr. Caparu, of what you were just suggesting in terms of what comes along with these grants that we get from the feds, or what doesn't come along with it. So I think it's good for the commission and the commissioners to have a little bit of a better understanding of how these grants actually work. Because you're telling me we've turned down grants for that very reason
Well,
in the past. And I don't want to get into the details of it, but we have.
right.
And where we said, no, this is just, we can't do it. So I think the more of an understanding the commission has of these kinds of things, and I don't know in terms of our reporting, whether the commission, and I'm just spitballing a little bit here, would want to know how many of these grants that we're taking must be supplemented by general fund just to get the work done, and because that opens up other questions then about whether we keep the money in-house and not contract out with it. Is that another layer of administration where we're peeling off some dollars because we got to do RFPs and all that kind of stuff to support it? So maybe that's another level of reporting. We want to know what grants are we getting that are costing us general fund dollars where the feds aren't really funding what it needs. One moment, Commissioner Anderson. I have Commissioner Baker McCormick, and then we'll
just
come
to
you.
that point that you were making.
To that point, but be careful. I'm tough on to those points.
was
To those points are not just a way to get in on the conversation.
Just to, for that, at that point, it might be something that we want, if we're in that position of having to forego those grants, to see what organizations are out there that might supplement our staff and maybe handle those, that do those for other communities, other counties, and I'm sure you do that, look at things like that, and see which makes the most sense dollar-wise, and that was the only point I was going to make.
Okay. Commissioner Baker McCormick.
Thank you. Just a clarifying question. I guess the funds are from the jail medical services. How does that decrease the services that you're providing in the jails if you're taking funds from that department?
Correct. We wouldn't have made a move unless we looked at it, and most likely looked at the trends on how much we spent in a particular area. And as I'm looking at your sheet, we reduced the service and contractual. And this area, I'm quite sure, is the CCS, part of the CCS contract. So I know initially we had some savings in that area from efficiency. So what we would have looked at is, are we saving, are we on trend or under trend? And based on, if I remember correctly, looking at this, we did have a little savings, but it wasn't much. So if something happened within the next couple of months,
Wow.
most likely we'll be in a pickle because we don't have that extra room.
In a pickle in terms of being able to move these
They have-
dollars.
Correct. We may not have the money next time.
Yeah.
Did I answer your question?
Yes.
Okay.
Okay.
Yeah.
And just going down that road just a little bit more too, because we just got the audit on CCS. One of the department's responses was we need to do better oversight, and we hired I think, an additional person to do oversight on that CCS contract.
Correct, one, and there's another one forthcoming on the finance side.
So, what fiscal year was this money moved in? 18, 19?
Yeah, I believe this is the year that just ended, correct?
That just ended. And the fact that we hired a couple of more people, that is probably going to eat into any surplus in the current fiscal year then, perhaps?
Well, correct. From what we see is that, of course, hiring a person will eat up some surplus, but also as, I think this is about the third year, CCS have found their way in and getting more efficient. Basically, everything that was said in the OAG report.
Okay. Okay. So,
You got a hand up behind you.
so we may be spending a couple of more nickels as a result of hiring. I'm sorry, Mr. Abbo, you have some input here?
Actually, this transaction wouldn't have any effect on the surplus because it's being totally funded. So it's coming from the general fund and then the money's being spent, so it would have zero effect on any surplus.
On any of the surplus in this account?
In this current year, yes, fiscal year. It's being funded, the additional services
Yeah.
are being funded by transfer in from the general fund. So that's why there wouldn't be any effect on the surplus.
Transferring from the general fund.
Well, from jail medical services.
Yeah. But I'm looking at, because that was a previous fiscal year that we transferred the money.
Oh, you're talking about the current, this coming fiscal year, or the fiscal year that we're in right now?
This came out of
Last year.
1920
No.
money? This came out of 1819 money.
1819, right.
So now that we've hired a couple of more people, the surplus that we saw in 1819 in this account may not be there in 1920.
I understand your question.
That's what I'm
sorry.
getting at.
Right, right.
And that,
Right.
that could be, so we may not. But nonetheless, I think it's kudos to take this money and put it to this, put it to this purpose, which is a very solid purpose. Okay, so a little more lead abatement going on in the county. Any other discussion of this 300,000 item? As I flip through, I see the next one is 1,038, and there's another 1,038 right after that, and then a 5,329. Just anybody stop me if they have a question. I'm not going to have a question till the 153,000. Reallocate funds from other health programs, material and supplies. To the health environmental programs. The nature of this, well, we know from where to where. What do we move this money for?
Right, this is an example of what I talked about earlier. This is definitely directly deal with public health.
Yep.
So we're moving around. So based on what we was actually funded by, what is
Right.
it, the CPBC?
Right.
Now we're moving money around to match how we actually spend.
So we put kind of a plug number in the budget, then we get the actual, and then we got to start moving dollars.
I don't want to say plug, our best estimate.
Call it what you like.
Yes, sir.
But yes, we have to put something in the budget as perhaps a placeholder.
Yes.
Okay.
I like that better, placeholder.
All right. In the back room, we'll call it plug.
Okay.
Any other questions on that item? The next one is an 8,125. Any questions on that? Then a 2,000. Any question on the last one? Okay, well, it's on there for a discussion item, and I think we've discussed it. Anything else from commissioners? All right, we'll roll the agenda then. Madam Clerk, what do we got?
Such other items as may be properly submitted before the committee.
Anybody have any such other items for us today? Since people aren't leaping to their feet, next item, Madam Clerk.
Public comments.
Any member of the public wish to address the Health and Human Services Committee? I'll be right back to you, Commissioner. Any member of the public would like to address Health and Human Services? Hearing none, I'm going to take a little prerogative here and recognize Commissioner Baker McCormick.
I'm sorry, I just meant to ask about the morgue tour.
Oh, please.
Did we get that scheduled, or,
Actually,
yeah, any movement on that?
I spoke with Mr. Kandrivas, and he is coordinating that. He's getting 2 or 3 dates together for us.
Okay. All right. Thank you.
Sounds good. And do you remember right offhand, Mr. Rainwater, when that contract with the University of Michigan to run the morgue on our behalf is up?
I do not, sir.
I think that's coming up fairly soon.
Yeah, I think we just.
Oh, we just did it about a year ago, maybe. Oh, okay. All right. So, okay. Andy, you got money for me, Commissioner?
Did anyone lose $1? I just found it. It's yours?
The department can always use
Well-
that money, right?
Well, I should be clear. Did you lose $1 in here over near that chair over there?
But I'll make sure it goes to public health.
Okay, well, I
The chair will take a motion to adjourn.
So moved.
Without objection, we stand adjourned.
Commissioner, the industry term instead of
Sorry?
the industry term instead of
Are we still live?